as of now, we are getting two conflicting trends in a way, or which are affecting moods very differently. You've got the United States, which is going ahead with its vaccine rollout, Pfizer, Moderna. You've got the UK going ahead with the rollout, and you've also got a lockdown and concerns over a new virus strain. So I'm just trying to, the worry is a question I keep asking: is the worst over? Or are we simply going to go through these highs and lows as happened between 1917 and 1919 with the Spanish flu, that the virus will mutate and possibly come out in new variants at various stages, so we can't really be complacent or exuberant even when we have a vaccine with us?
Rajdeep, the big difference between the flu, 1918 flu, and now is obviously what science and technology can do for us. We understand so much more. There's no sequencing, real-time sequencing has been done at this scale in any previous outbreak. And that's why we're able to track this. But of course, that also creates anxiety because, you're learning all of this. But it's a good thing. I think it's good that we learn these things and we're prepared and we're not taken by surprise. I believe that we're in a good place with the vaccines, that we are going to turn the corner, though not immediately, because, you have to scale vaccines to enough people in order to create that population immunity or herd immunity. So we start by protecting the most vulnerable or the most high-risk groups, and then gradually vaccinate more and more of the population. That takes time. And so till then, the public health measures are important. So when you talk about having a lockdown and having the vaccine both, yes, for some time you will need both. You will need the vaccine to be rolled out. You will also need to keep in place or even stronger measures to prevent transmission. Because another thing about viruses mutating is that the more viruses you have in circulation, the higher the burden and higher the load and the higher the number of people, the more chances of new variants developing. So if all countries focus on controlling transmission, bringing infection rates down as low as possible, while vaccines are being scaled up, that is the best situation. And then I think in the second half of 2021, we should begin to be in a much better place.
So from what you're saying, the next 6 months again remain critical. Am I correct? That you will need possible localized lockdowns. You will need to control the transmission till you've achieved a certain level of vaccine of vaccinations in India and across the world. Till you've got that critical mass, you will have to go ahead potentially with these various forms of mini lockdowns, if I may call them that. Am I correct?
Absolutely. I mean, you could call them lockdowns or not. I mean, it's not essential that we have to impose lockdowns. I think what they've done in England now is because of the exponential growth and the exponential increase in cases that they were seeing in that region. So we don't have to go into lockdown all the time. You just need to strengthen your public health measures. Your testing, make sure that there's enough testing still going on, the quarantining, the tracking of the contacts, the isolation and taking care of patients, all of those, and the behavioral changes we've talked about, the mask wearing, the avoiding of crowded places and close contact, the respiratory hygiene and so on. So all of those things, both individual behavior change and what public health agencies and governments are doing, yes, definitely for the next year, I anticipate we would need to continue to focus on those as we wait for vaccines to be scaled up in larger and larger populations. All the time keeping an eye on the virus to ensure that it doesn't change again or doesn't mutate again. And scientists now know how to deal with that as well. So even if there is a mutation which completely changes spike protein, I think there are already groups thinking about how you would tackle that and how you might change the composition of the vaccine. So we need to keep that also in mind and have people working on that, while we haven't reached that point now. So I would say in the next couple of weeks we'll learn more, but I think the basics are still very important.